appointments does it take and what can I expect? This video series takes the place of at least what I used to do in 2 appointments during in-office visits. I realize time is precious and I try to maximize everybody's time by giving all the information in an organized manner, and it's a very important part of informed consent to allow you to be able to choose what is the best treatment for you. The first official in-office visit would be to take records to start oral appliance therapy. This is based on receiving all the forms from the doctor and the insurance and having a prescription and ideally a more recent sleep study. So the first appointment would be a review of all the paperwork, impressions, pictures, and measurements to decide where we're going to start with for the oral appliance therapy with the jaw position. After that first visit, 2 weeks will pass by before you get your appliance that has been custom made by the lab. And during the second visit, it's about an hour, and we spend a lot of time going over the appliance, making sure it fits well, so that you know how to clean it, so that you can take it in and out comfortably. And following that visit, there'll be quite a bit of follow-up to make sure that you're not having any side effects. And there might be some other follow-up visits to check on the appliance or make any adjustments needed. Then with keeping the sleep log, you can monitor your own progress and advance the appliance until you feel more effects of the appliance, or you can come into the office where I can help you to do that. This will be continuing on for about 2 to 3 months until you think you are ready to be seen by your family doctor again. So the family doctor will be updated, and the sleep doctor as well, as to the progress that we're making with the oral appliance therapy. Once we're satisfied that the ideal position has been reached, I will send a final letter to the family doctor to say that potentially we're ready for another sleep study. The same thing would happen if you were having a CPAP machine. They like to do a follow-up study either way to see how effective the treatment is working for you. After that visit, we have a 6-month visit, and that visit is again to review any changes in the bite and to see how you're doing with all your homework with the morning occlusal guide and your jaw exercises, and to make sure everything's comfortable. All of that is included in the fee for the price of the oral sleep appliance therapy. Following that, there's going to be an annual checkup, so once every 12 months to check in to make sure the appliance is working well, any adjustments that are needed. If the appliance is broken or needs repairs, it will have to be sent back to the lab. The lab does have some warranties, but sometimes if there's a breakage, they might charge a small repair fee. So these things are all things that you should need to be aware of. That ongoing, there'll be an annual checkup involved, and depending how long these visits take, there will be a fee charge for that. We will try to do as many phone consultations as possible or visits through Zoom to minimize any visits. However, in-person visits are the best way to monitor the appliance itself and to make sure we're being proactive in any changes that are happening.